Data security also wants to know what HTM is doing to reduce the risk. Usually at the HTM clinical engineering leadership level, they have some engagement with enterprise data security, some visibility around the risk, and should be contributing to visibility of that risk and efforts to reduce it. So HTM needs an ability to paint a picture, share metrics and patching state with data security. And without a strategy or a centralized patching solution, that's often difficult to do with the existing tools that HTM has. And data security wants to know, why does it take so long to patch and update IoMT? And this is again very different between managed devices and clinical. Patches for IoMT, they have to be validated by the vendor before being applied, and different vendors validate and disclose patching updates at different frequencies and different cadences. There are increasingly more tools and solutions that are more safely applicable to IoMT endpoint management. Not a lot of this going on several years ago. We're seeing more and more of it as the demand increases and organizations look to secure the whole environment. And this is applicable to organizations if they're mature enough and have the competencies and internal security alignment for managing new IoMT tools and approaches to securing those devices. It cannot be just an application of the enterprise workflows, security expectations, and tools to the IoMT devices. But it can be done if there's collaboration between those teams and an acknowledgement that there needs to be risk reduction made to the IoMT domain with a specialized approach and tools. Many tools, agents, software partners, and especially the expertise on how to use them are becoming available depending on your organizational needs and goals. So centralized patching, broad topic, and in the IoMT domain, lots of ways to do it. Who's it for and what's required, I think is important. Centralized patching, typically not a first step for an organization. But it usually accompanies, an MDS program or a medical device security program initiation and deployment. So once there becomes a focus and some dedicated resources and some business goals established, that includes governance and policies and procedures and some oversight. That's when it's appropriate to introduce patching and other risk management, vulnerability management in general. Generally, some things that you really need to have in place is IoMT-specific governance and a change process that HTM understands and participates in. Very important. A well-defined workflow and communication for all stakeholders. And of course, the people, assets, and skills to assess the devices and determine current state and obtain the patches appropriate for those makes and models. And a tool or solution for distributing, monitoring, and reporting the current patch state. Patch rate success, as all clinical engineer and HTM folks know, it's got to be documented or it didn't happen. And same applies to patch state. You want to be able to get that data without having to scour individual work order report languages. It requires a robust and passive and preferably remote device profiling ability with high fidelity visibility of medical devices. So visibility is really important, obviously, of your connected medical devices. They need to be accurate as best you can so that you know what you have connected to the network. If you have high fidelity, you can determine the patching state, and of course that will lead to prioritizing your approach and which parts of your fleet you tackle first. It definitely requires a mature, cooperative relationship between HTM and the enterprise data security teams, including infrastructure. Deployment of the tools, configuration, and ownership of those endpoint management solutions requires all of the teams to be effective. You also need a strategy and goals to be able to incorporate patching into the hundreds and thousands of HTM device encounters in order to be efficient. That's an important point, as HTM, who have very full plates, continually take on more work. That applies with security, and obviously adding resourcing is helpful but difficult to obtain. And we know HTM has requirements to encounter devices by the hundreds and the thousands monthly. It's best to leverage those encounters in an efficient way to make these updates and apply risk reduction controls while you're doing those scheduled and unscheduled maintenances. Some benefits of centralized patching for IoMT. It's much the same as it is with the enterprise. The benefits are the same. You can streamline patching, obviously. Devices can be managed in fleet groupings. Patch application to devices can also be managed. You can allow disapproved validated patches to be applied. You can control it by creating the fleet groups, and whatever your tool or method, you have control over what patches you make available to be taken by each device type and model. Better visibility. Devices can be monitored by these solutions so that you don't need to track them down. As often is the case, a question appears and a biomed department is, has a fire drill underway where you're out there manually trying to do inventory checks, waiting for things to be out of production so that you can get your hands on them and validate. Centralized patching solutions allows you to, enroll devices into your solution and view their state, their patch rate success remotely, which leads to much faster zero-day event responses, and instead of simply dispatching the whole team to the floor, running around trying to locate software revisions and patch updates. Fewer tech requirements is a benefit, obviously. A patching strategy and solution tools, reduces the need for significant increases in technical competency in HTM. HTM is very good at what they do. They're constantly asked to do more. And some of those mores require new or different competencies. And security may be one of those for your organization, where it's important to you today, but you don't have a medical device security team. You don't have IoMT specific analysts. And so you want to apply risk reduction, and centralized patching strategies and solutions allow you to, affect the fleet with fewer resources and skill set additions to the existing HTM department. It allows HTM to contribute to organizational goals for risk reduction, right? Typically, HTMs focus on environment of care, PMs, fixing broken things, with patient safety being a priority. And we know data security and the CIO and the CISO are responsible for enterprise security and risk reduction, patching strategies in a program to apply risk reduction controls allows HTM to contribute to that system level risk reduction. And as I mentioned earlier before, biomed is the boots on the ground, but the more of these single pane of glass and centralized solutions that we can put in place, including patching, just allows for faster response and less boots on the ground, doing a manual validation of the thousands of devices that are in the environment.